Hello.
Hello, good morning, sir.
Oh, Priya madam, can you hear me?
Yes, yes,
Yeah,
sir.
good morning.
Yes,
I
sir.
was checking my audio actually.
Yeah,
It's audible. Oh,
yeah, yes, sir.
ഇപ്പം ഓഡിയോ ഉണ്ട്. നീ പറഞ്ഞ അങ്ങോട്ട് കേൾക്കാം.
Hello.
Hello, sir.
Hello, madam.
Yes,
Yeah,
sir.
good morning, madam.
Good morning, sir.
Shall we begin now or we'll wait for students to join?
For 5 minutes, we can wait, sir. I
Wait.
post a message in the group, sir.
Okay. Right, madam. Right.
Because only
Yeah.
23 are joined here and only 35 are joined on the YouTube.
Okay. Fine, madam. No issue.
Yes,
We'll
sir.
wait
Yes,
for
sir.
it. Huh?
Yes, sir.
Oh.
Bharat sir.
Yes, madam. Can we begin?
Yes, sir. Actually, it's 10:10 now.
Okay,
Yeah.
okay, fine. Madam, before beginning, do you have
Yes.
the list of mentees with you?
Yes, sir. I'll share you, sir.
No, no. Actually, that list is there
Sir,
with me,
sir,
but
your
there
voice
are
is
six,
breaking,
seven
sir.
mentees and three faculty members in the same column.
Sir,
Hello,
I
is
couldn't
voice
hear you.
breaking?
Yes,
Hello.
sir. Yes, sir. Yes, sir.
Okay. Wait a minute. I'll
Yes, sir.
change something. Hello. Can you hear me, madam?
Yes, sir. Yes, sir. Please tell me.
Okay, okay. Yeah. I said that list is there with me, but that list is quite confusing. Like there are six, seven mentees and three faculty name written in the same column. I don't know which mine mentee. I think Elizabeth Susan, Fatima Imani, Fitha Fatima, and Hannah Fatima. I think so.
Okay, sir. I'll check and I'll send your Mendy's list to your WhatsApp number.
Okay. Right.
Okay, sir. Okay, sir. No problem.
Okay, so shall we begin now?
Yes, sir.
Okay, right. Good morning. Good morning, all the students of first year of class teacher, faculty members of pharmacology department, and other faculties. We are here to introduce the department activities, and the members in the department. So first of all, I'd like to welcome all the students in this session, where the pharmacology department is going to introduce themselves with you. And I think you already had some interactions with other departments earlier. Here, first I would like myself, and then I'll move on to the next segment. My name is Dr. Bharat Mishra. I am working as a professor and head of the department of to Lucknow. Right now, I'm here only, and I think last more than 4 years with the Nirmala College of Pharmacy. I have around 15 plus years of experience in this particular field. I have worked in India as well as abroad. My area is the research and
Hello, sir. Hello, sir.
hello.
Hello, sir. Sir, I think your network is not stable.
Hello.
Hello, Bharat
Hello.
sir.
Yeah, madam, can you hear me now?
Yeah. Just now we can hear.
Okay, fine. Sorry for the interruption. Some network issues, I think. Yeah, so I was talking about what the area of interest I have. So in that respect, I am also heading the research and development cell of this institution, where slowly when you are coming in. So slowly you will get to know that what kind of research we are performing and how the students are getting involved with that. I think Prija Madam will take you into that ride, and she will tell you what all the things we are doing here. So this is about myself, and other than me, we have 5 more members in my department, and those members will introduce by themselves to you, and you can interact with them. I will be there throughout this orientation class with you. Those who are in the YouTube live can ask the questions on the WhatsApp group. I will be there to answer you. And even during this live session also, if you have some questions for me, then I will answer you. Otherwise, all the faculties will be there for you to answer, right? So I welcome you all to this institution, as well as in this particular meeting where we are introducing the pharmacology department to you all. And by these words, I would like to invite Prija Madam to take the further proceedings in her hand. Prija Madam, please.
Thank you, sir. Good morning, dear students. I am Dr. Preeja G. Pillai, working as a professor in Nirmala College of Pharmacy in Department of Pharmacology. First of all, I welcome all 100 students of B.Pharm to our Nirmala family. This is the first time we got a huge number of students in our B.Pharm class. So this is the first batch. We have 100 students. So warm welcome to all of you, to our department, as well as to the Nirmala College of Pharmacy. And then regarding myself, uh, I have done my M.Pharm and B.Pharm from KM College of Pharmacy, Madurai, and PhD from Berhampur University, Odisha. I am having 17 plus years of experience in teaching. I am interested in research as well as in academics. My passion is teaching. So now I will share you a few activities that are happening in our department, as well as what are the subjects we are dealing in your B.Pharm course. Okay. Sebin sir, please allow me to share my screen. Elsina.
Now it's not visible, ma'am.
Actually, it's showing that host disabled participant screen sharing.
Okay, I'll check. Sorry, I'll check, ma'am. One second, ma'am.
In meantime, actually, I am the mentor of 4 students in the B.Pharm, that is Ebin Joby, Apirami, Abia Devi, and Aksa James. So these are the 4 students. These are the mentees of myself. Later, I will contact you.
Ma'am,
Yes, yes,
I have made you co-host. Can you please check whether you can share the screen or not?
yes. Now it's okay.
Okay, ma'am.
So, Elsina madam, now screen my PPT is visible now?
Yes,
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 ma'am.
ma'am.
Yes, okay, thank you. So now I'll introduce what are the activities and what are the activities it is happening in our department, as well as what are the subjects we are dealing in your entire course period. So the first of all, the subjects we are handling by the Department of Pharmacology in B.Pharm curriculum is, these are the subjects. This comes under in first semester, second semester, fourth semester, fifth semester, sixth, seventh, and eighth semester. In first semester, there are human anatomy and physiology, theory and practical is there. Second semester, again, the continuation of human anatomy and physiology, theory and practical. In fourth semester, you will start learning a new subject, that is pharmacology 1. In fourth semester, you have to perform practical also. In fifth semester, again, the continuation, the remaining portions of the pharmacology, this will come under in pharmacology 2. In pharmacology 2 also you have to perform the practical. Again, in the sixth semester also you have to continue with the pharmacology, theory and practical. And on the seventh semester, actually there is one session is there that is known as practice school. Practice school, actually this is a non-university paper, and this is it is the particularly it is purely chosen by the student. If the student, if you are interested to do practice school in our department, then only we can conduct the practice school for you. Okay, so actually what is the need of practice school is, practice to make the student to implement your knowledge in a practical way. It is to implement your theoretical knowledge in a realistic way. Okay, so this is purely, it is the students option. It is not the fixed by the department. If you are interested to do practice school under pharmacology, then you can do. Okay, so for this is there will be 3 or 4 modules, and the total hours allotted for the practice school is 150 hours. And after completing the, actually within the seventh semester, you have to complete this practice school. And at the end of the practice school, you have to prepare a report with not more than 25 pages. And based on the report, as well as based on the practice school, you have to present this practice school report in front of the department staffs, and that will be evaluated by one subject expert at the college level itself. Okay, so the need of practice school is make you more knowledgeable about any particular topic, and also you can apply your theoretical knowledge in a realistic way by doing some practical, or mainly by doing the practicals. Okay, and on this 8th semester, again there is one subject is there, experimental pharmacology. Experimental pharmacology, actually that is an elective subject. Okay, that is also chosen by the student. If you are interested to do if you are interested to take experimental pharmacology as an elective, then definitely those interested student can take the experimental pharmacology as an elective. So what is the intention of this elective subject is to make in-depth knowledge in specialized area. So suppose if the topic or the subject, if it is experimental pharmacology means, then you have to gather in-depth knowledge in experimental pharmacology. Okay, so make the student more knowledgeable in specialized area. That is the purpose of elective subject. So in the 8th semester, you have to select 2 elective subjects. Each elective subjects, it is for 45 hours. And for elective subject, there will be sessional examination. That is, there will be internal examination, as well as there will be semester examination. And the sessional examination will be conducted for 25 marks, and the semester examination will be for 75 marks. So total marks for the elective subject will be out of 100. Okay, and in the 8th semester, you have to select 2 elective subjects. Okay, so these are the subjects we are dealing in your B.Pharm curriculum. Next is the total hours allotted for the each subjects is human anatomy as well as for pharmacology. There are 3 hours theory in a week. Apart from this 3 hours, one tutorial hour we have to engage, and the practical hours allotted for these subjects are 4 hours per week. And for practice school in semester 7, practice school hours are 12 hours, and for experimental pharmacology per week there will be 6 hours, and for practice school there will be 12 hours per week. Okay, so these are the hours allotted for the theory and practical. Actually, this is the syllabus. I have included only the semester 1 syllabus. Actually, semester 2 is also, in semester 2 also you have to study the human anatomy and physiology. Actually, in semester 1, there are 5 modules are there. And in this first module, which deals about the introduction part, that is, what are the terms which are commonly used in human anatomy and physiology, and what is the cellular level of organization, and what will be the tissue level of organization. Actually, in detailed, the system, body systems, which are included in the unit 2, unit 3, unit 4, and unit 5. Mainly cardiovascular system, and the system deals with the peripheral nerve system, and the system deals with the blood, then a lymphatic system, and then skeletal system, and the and skin. These are the main systems which are included in your semester 1 theory. Okay, and the remaining systems that will cover in your semester 2 theory. Okay, so now total 11 systems are there. So only this many systems will be covered in the semester 1. The following will be completed in your semester 2. And based on this semester 1 syllabus, you have to perform few practicals also. These are the practicals you have to cover in semester 1. That is the study of different tissues like epithelial, connective, muscular, and nervous tissue. And you have to study what are the types of bones and what are the features of the bones of the human body. And next is, there are some blood experiments are also there. You have to count, or you have to calculate the number of white blood cells present in your body, in your blood, and number of red blood cells of your blood, that you have to count. Then you have to estimate the bleeding time of your own blood, and you have to estimate clotting time and hemoglobin concentration, and you have to detect your blood group, and you have to find out the erythrocyte sedimentation rate of your own blood. Okay, and then few more experiments like you have to find out the pulse rate, heart rate, and the blood pressure of any subjects. Okay, so these are the few experiments you have to perform in the semester 1. Okay, so actually the anatomy, human anatomy practical, it's little bit painful experience. So it will be a painful experience because you have to perform with your own blood. So, but it will be very interesting. Okay. Next, these are the scheme for internal assessment as well as end semester examination. So in this, I will show you only our subjects, that is human anatomy and physiology theory. In this internal assessment part, internal assessments means the assessment made by the college. Okay, so that is also known as sessional examination or sessional marks. Okay, so internal assessment will be for 25 marks. Out of 25, there will be 10 marks for continuous mode. Continuous mode. Continuous mode means we are monitoring the student, and activity, based on the activity and based on the attendance of the candidate, the teachers are allotting mark to the student. That is the continuous mode. And the sessional marks means it is purely based on your written examination, and that examination conducted by the college. So that will be out of 50. Okay, so continuous mode and sessional marks together, it will be out of 25. And the end semester examination, that means the examination conducted by the university, it will be for 75 marks, and all together for human anatomy theory, it is out of 100. Okay, next is what are the criteria considered for the continuous mode? Continuous mode will be considered for first one is attendance. Attendance is considered. Then you have to perform 3 academic activities. Academic activities such as either you have to carry out any assignments, you have to write and submit any assignments, or you have to involve in a group discussion, or you have to take any seminars, or you have to participate in quiz. So based on the any 3 activity, we will evaluate you. And next criteria is student teacher interaction, how you are interacting with the teacher. Okay, so student teacher interaction is also one of the criteria for continuous mode. Okay, next is in attendance. Actually, there is again criteria, sub criteria for the attendance. Those who are having 95, more than 95% of attendance, they will get 4 marks. And those who are having 90 to 94, they will get 3 marks. And 85 to 89, they will get only 2 marks. More than 80, 1 mark. If it is less than 80, 0 marks. Okay, that means for writing the end semester examination, you should have at least minimum 80% attendance. Okay, 80% attendance in all subjects. So that is the eligibility criteria for appearing the university examination. If the students are not having 80%, minimum 80% of attendance, then you will not be eligible for appearing the end semester examination. So all of you carefully you should be careful on this attendance, because you will get marks on attendance, and if you are not having 80% attendance, then you can't appear for the university examination, because it's not like a school. Our course, it's a professional course, so attendance and all these activities that are mandatory in professional courses. So you have to maintain attendance, because you will get easily, you can score 4 marks based on your attendance. Okay, so these are the internal assessment as well as end semester examination schemes. Next is the how we have to how we are conducting the sessional examination in theory as well as in practical. Actually, this is the sessional examination pattern of theory. That is, there are long answers as well as short answers and some objective type answers. And normally, actually, we are conducting the sessional examination in 30 marks. And from this 30 marks, we will calculate it for 15 marks. At the time of sending marks to the university, we need only marks in 15. Or 15 marks will matram madi. So we will convert this 30 mark into a 15 mark. So in that question, there will be one long answer. Long answer mark will be for 10 marks. And there will be 2 short answers. Each question carries 5 marks. And objective questions will be 5 objective questions. And for this, each question carries 2 marks. By this way, sessional examination will be conducted for 30 marks. Okay. And in a semester, you have to give 2 sessional examinations in practical as well as in theory. So in theory as well as in practical, you have to write 2 sessional examinations, and the theory examinations will be conducted in 30 marks, and that will be finally calculated to 15 marks. And in case of any non-university examination, like mathematics or any communication, say, the examination pattern will be different. And next is the scheme for practical examination. actually how to carry out the practical examination is, this is the scheme for practical examination. There will be synopsis for 10 marks. Actually in synopsis there is one more option, one more criteria is also there, spotters. In case of anatomy there will be one more criteria, that is known as spotters. Synopsis means actually you will get one or two questions. You have to questions that may be based on the theory part or maybe based on the practical part. Based on the practical or based on the theory, you will get either one or two questions and you have to answer those questions. So that is known as synopsis. And synopsis, it may be for either for 5 marks or for 10 marks. And there is one more, this is there, that is a spotters. Spotters means you have to identify the object and then you write about those object. Then experiments, you have to perform it for 25 marks, and then viva voce, that is for 40 marks, and then finally we are converting into the 10 marks. Okay, so these are the scheme. This is the question. Actually, this is a one sample question of university, that is KUH sample question. There are 2 essay questions are there. Each question carries 10 marks, and there are 5 short answer questions are there. Sorry, 7 short answer questions are there. Each question carries 5 marks, and there are answer briefly questions are 10. Each question carries 2 marks. In such a way, there are maximum mark is 75 hours. You have to answer all the questions and you have to draw diagrams wherever necessary. So this is one sample question of KUHS, Kerala University of Health Sciences. Next is why to study anatomy. Okay, in human anatomy and physiology, you will study the normal structure, shape, size, and location of the body systems or body organs. Okay, and in physiology part, you will learn how the body organs function or how it works. So the physiology, this normal structure and the normal functioning of the body system or the body part or body organs, you will learn in human anatomy and physiology. So the basic knowledge about human anatomy and physiology, this will help you to study or help you to learn the following subjects in your subsequent year. The following subjects such as, you have to study pathophysiology in your second year, in your second semester, and you have to learn pharmacology in your fourth semester. So actually the basic of pathophysiology and human anatomy, pharmacology is HAP, that is human anatomy and physiology. So with the knowledge of basics, normal structure, and with the knowledge of normal physiology of the body system, you can easily learn pathophysiology, and also you can easily learn pharmacology subjects in your subsequent years. So human anatomy, it is crucial for medicine. So through this studying of human anatomy, you can work in the field, and this will also help to improve other people's health and well-being. And also this will help to develop a certain set of skills and how to work in laboratory, and you can plan some experiments, and you can do some data interpretation, and you can be involved in the research. So these are the skills you will attain in your B.Pharm curriculum if you are studying, or if you are performing practicals, as well as if you are studying human anatomy and the subsequent subjects. And next subject comes under our department is pharmacology. Pharmacology means it is the science of drugs. Actually, it is a word derived from Greek words. Pharma means drugs, and the logos means it's a knowledge. That means the information about the drug. So pharmacology, which includes physical or chemical properties of the drug, biochemical properties of the drug, then pharmacological properties of the drug, pharmacological actions of the drug, drug, mechanism of action of the drug, therapeutic uses and adverse effects of the drug. So our subject is pharmacology, and which mainly deals about the drug. It includes all about all the features like physical property, chemical property, biochemical, then mechanism, therapeutic uses and adverse drug effects or adverse effects of the drugs are also comes under pharmacology. And the universe of pharmacology. So actually the pharmacology can be applied in research, and this can be applied in industries, this can be applied in academics, and there are some more special domains are also there. So we will look what are the applications of pharmacology in research. So the applications of pharmacology in research is which is involved in the drug development, that is in the drug discovery. Okay, suppose if any new drug, if it is discovered means, then that does a drug discovery comes under, or that is also comes under the pharmacology. So application of pharmacology in research is drug development. And in the drug development, there are mainly three phases are there. First one is drug discovery phase. That means introduction of a new entity for any specific disorder or diseases. That is known as drug discovery. And the second phase is known as preclinical phase. That means the same new entity or the new lead molecule is testing on laboratory animals before applying into the human. That is known as preclinical phase. That means suppose if we introduced any new entity, then we have to check the toxicity, or we have to check the effect of those agent in animals before testing into the human being. Because suppose if you are applying directly to the human being, sometimes it may cause death to the human being. So okay, so we have to avoid the toxicity in human being. We have to estimate the efficacy, as well as we have to estimate the toxicity in animals, laboratory animals. That comes under preclinical phase. Next is the clinical trial phase. That means the same drug is applied in a human being. Actually the clinical trial, which will be conducted as the study carried out in human beings, and there are number of phases are involved in the clinical trial. So by this way we can we can finely tune the developed drug in a applied form. Okay, so that comes under the clinical trial phase. So application of pharmacology in research is in the development of drug. Next is in the academics. So the application of pharmacology, it is in undergraduate education as well as in the postgraduate education. And in undergraduate, mainly we are dealing with the drugs, that is introduction about the drug, then what is the mechanism. For example, suppose if paracetamol causes, it's an analgesic antipyretic means, then how it causes, how it produces antipyretic effect, or how any drug produces analgesic effect. So what is the mechanism? So mechanism of action comes under this. Then prescription writing, then we are dealing with all the pharmaceutical preparations, then identification of adverse drug effect of any drugs. These comes under the undergraduate education. Then in the postgraduate, basic research. What are the research methodologies? What are the methods for finding any particular activity of any drug? Then experimental pharmacology. What are the experiments? What are the practicals we have to cover under the pharmacology? Then pharmacokinetics means the absorption, distribution, metabolism, and elimination study of any drugs. Then dynamics means what is the mechanism, how the drug produces its effect. These are also comes under the pharmacology. Then pharmacovigilance. Pharmacovigilance means it is the study to determine the adverse drug reactions of any marketed product or any newly marketed product. Then clinical pharmacology, as well as the application of pharmacology in clinical and the therapeutic drug monitoring. These are also the applications under post-graduation education. Next is the application in industries. Already I mentioned in industries there is a separate wing is there, that is research and development, R&D cell is there. So their function, their responsibility is to carry out research in either in new molecules or in existing entity. In existing lead molecule, we have to do the research. That is the responsibility of the R&D cell. So the pharmacology having application in research, then pharmacology people can work as a medical advisor, then this having role in medical transcription, medico marketing, product management, and contract research organization training, etc. And medical advisor, as a medical advisor, we can provide analysis of health population, then evaluation of primary care services, planning of certain services, then advice on effective prescription, then education for training sessions for certain, for any general practitioners. So these are the services we can provide, that is pharmacologists can provide these services. Next is the medical transcription. Medical transcription means actually it's the process of converting the voice recorded report into a text format. Conversion of a voice recorded report to a text format is known as medical transcription. So voice recorded report of any physician can be converted into a text format, and this process is known as transcription. Okay, so nowadays number of companies they are conducting such medical transcription areas, and they are hiring the B.Pharm candidates, as well as they are hiring M.Pharm candidates as a medical transcriptionist. Next is the medico marketing. Medico marketing means it's the promotion of the sale of pharmaceuticals as well as drugs. That is advertisements, business of advertising, or other means of promotion for the sale of pharmaceuticals of the drugs, that comes under medico marketing. For in medico marketing also we have the applications. Next is the CROs, that is contract research organization. Contract research organization means actually this organization, they provide clinical studies or clinical trials for clinical trial support for any drugs or medical devices. Actually, the CROs, they provide technical support to the pharmaceutical industries in the form of outsourced pharmaceutical research services. Sometimes the industries, if they don't have enough facilities, or suppose if they don't have much time, means then the industries can take the facility, can utilize the facility of outsider, so outside facilities or outside laboratories. So sometimes the pharmaceutical industries, they will utilize the facility of other organizations. Such organizations are known as contract research organizations. Normally contract research organization, they will work for the pharmaceutical industries or any biotechnology, pharmaceutical biotechnology industries, for carrying out any clinical studies or for carrying out any clinical trial support. Actually, for carrying out this studies, the clinical research organization, they need the support of pharmacologists. Next, special domains are pharmacovigilance. Already I mentioned you, that is the reporting of, it is the study of or monitoring the effect of drug after that have been licensed for use. So after obtaining the license for use, those newly marketed drugs, adverse effects can be monitored by pharmacovigilance system. And in pharmacovigilance, we have special role. Next is pharmacoeconomics. Pharmacoeconomics means comparing the value of one drug or drug therapy with the another one. Okay, comparison of value of any drug or drug therapy to another is known as pharmacoeconomics. And pharmacoepidemiology means it is the study of use and effect of drugs in a well-defined population. For example, the study of in any particular population, that comes under pharmacoepidemiology. So in all these three special domain also, the pharmacologists can show our skills in pharmacovigilance as well as in economics and in pharmacoepidemiology. And next is what are the general applications? A good pharmacologist is desired in following field: R&D, that is research and development, in industry as well as in research centers. There are a number of research centers are in India as well as in abroad. So in India and in research development centers we can work. Then academic research, then research centers of non-industries, then research fellows in government research center. For example, in Kerala University of Health Sciences is also having a research center, well developed research center. All the pharmacologists or pharmacy people can work as a research associate in university level as well as in DST, DBT, then ICMR, etc. So in all research centers, that is also one of the option for pharmacologists. Then scientists in government settings in India as well as in abroad. So the Indian laboratories, our government set up laboratories in India as well as in abroad, where we can work as a scientist. Next is demonstrator in foreign universities. Example, for the universities in Middle East as well as in European countries, the universities in Europe also hire the demonstrators from India. And also we are eligible for higher studies, especially in pharmacology, higher studies in terms of MS or a PhD. We can do PhD in foreign universities as well as in Indian universities. Next is in specific areas we can concentrate. Suppose if we are not interested to work as a pharmacologist, then we can concentrate in particular area, in specific target we can concentrate. Those areas are new drug discovery research, that is the defined area. Then pharmacokinetic studies, that means absorption, distribution, metabolism and elimination study of any drugs. Then bioequivalence study, that means comparison of two formulations. And then toxicological studies, that means comparing the toxicity of any drugs. Then preclinical research, that means the research on animals, that is research of drugs on animals. Then molecular pharmacologist, that is the study of drugs on a molecular level, that is on a cellular level study. Then on genetic study. Then as a scientist, then proteomics, that is the study on proteomes. Proteomes means the study on proteins and its functions. Then we can concentrate on cancer research, and also we can concentrate on genetic therapy and its related researches. We can also concentrate in medical writing. Okay, so these are also certain specific applications. In those areas we can concentrate our we can build those areas as our career. Okay, so these areas can also be select as a career after your B.Pharm or after your PG. Next is the higher studies options. Those who are having interest in higher studies, then they can go for M.Pharm pharmacology, or they can opt any MSc courses in proteomics, or MSc in pharmacology, and MSc in molecular pharmacology, and MSc in industrial pharmacology. Then we can hire MS courses in abroad also, that is oncology. In oncology we can hire the MS courses. Then in genetics, in gene therapy, then in nuclear pharmacy, in medical coding, then animal house management, toxicology and molecular pharmacology. These are the areas where we can, or these are the courses where we can go for higher studies in abroad. Okay. Next is the departmental statistics. Already sir has mentioned we have 2 professors and 1 associate professor and 3 assistant professors. And one main thing I have to mention mentioned about our department is actually our department, it is one of the highly motivated department, especially in terms of research activities. And we have 81 publications in our department. And from B.Pharm students itself, last year we published 10 papers. B.Pharm students, they published 10 papers from the pharmacology department. Actually, if you are comparing, because last academic year, that was our college activities that was closed due to the lockdown, but then also our B.Pharm students, they published 10 papers from the pharmacology department. So from that number itself, you can understand that our department, it is highly motivated, and it is it is one of the highly involved, means our department is involved in research as well as in the publication activities. Next is what the department will offer. We can offer in-depth knowledge of chosen subject. If you have selected any option or selected any subject from our department, definitely we can give you a in-depth knowledge in the chosen subject. Next is the explanation of subject in light of industrial requirement as well as job prospects. So based on the industrial requirement, we can guide you, and as per the requirement of job requirement, or for fulfilling the criteria of the job, we can guide you. Then practical and scientific approach to the subject, we can show you what will be the practical aspect of particular subject and how you can scientifically approach to the particular subject, and we will assist you to publish the articles. So these are the areas where we can guide you from our department, and that's all about our department. So with this, I am extending my hand to you, B.Pharm students, that we are here for you. We will provide you all support. If you have any queries or if you have any difficulties, especially about the pharmacology related subjects or human anatomy subjects, you can approach any of the department staff. Actually, we are here, we are 6 members are there in our department. Suppose if you have any queries or related to any subject, or if you have any doubts related to the research, or in any time, you can approach HOD or other department members. Okay, so with this, I am winding up. Thank you so much. If you have any queries, you can you can text, or otherwise you can ask at, later, I think so. So I am giving my responsibility, or I am giving my duty to our faculty, that is Miss Nancy Jose, Associate Professor of Pharmacology Department. Nancy Madam, over to you.
Yes, madam. Thank you, ma'am. Hello. Madam, will you stop sharing your screen?
Yes.
Good morning, dear students. So myself, Nancy Jose, Associate Professor, Department of Pharmacology. I am from Kuruppambadi, that's near to Perumbavoor. And I have joined Nirmala on this October. So I'll be handling this HAP in this semester. And I think our teacher madam had given all aspects regarding this HAP subject, not only the HAP, whole department of departmental subjects and what are the activities are going on. And I think now you are all aware about the sessional exams and what are the subjects, practical, everything. And first of all, I want to tell you one thing. You have to love the subject. Then only it will be very easy for you to study. Okay. First of all, you have to love the subject and try to study well. And I think all the 100 students have allotted mentees. The mentees will be contacting you. My mentee is Liana Hassan. I will contact you and I will give you my number. And HAP is one of the most interesting subjects, as well as in practical side also. We can do the practicals very interestingly. And dear students, we can study together and we can grow together. So best wishes for all of you. and we'll have a good interaction in coming days. And I'll be handling this subject in, all topics, main topics I'll be handling, and the subject will be sharing with Dr. Preja Madam. So thank you, dear students. Once more, I will welcome you all to this Nirmala College of Pharmacy. Thank you. Now, I over to Manu Madam.
Good morning, all. I hope you all got an idea about our subjects, human anatomy and physiology, as well as pharmacology. Now, let me introduce myself. My name is Anu Sebastian, working as an assistant professor in the Department of Pharmacology. Regarding my education, completed B.Pharm from Nirmala College of Pharmacy itself, and M.Pharm from KMCH College of Pharmacy, Coimbatore. Now, I'm completing almost my 2 years of teaching in Nirmala. That's all about me. So my mentee is Ms. Harichandan IS. I will interact with you personally. Wish you all the very best for your future. And now I like to invite Ms. Anusha Madam for introducing herself. Anusha Madam.
Yes, ma'am. Thank you, Anu, ma'am. Okay. Myself, Anusha. I'm currently working as an assistant professor in the Department of Pharmacology. And I completed almost 2 years at Nirmala College of Pharmacy. And basically, I'm from Idukki district. And I think almost all details are explained by our madam about our subject, departmental subject. That's about the HAP and also about the pharmacology. And my mentees, I have 2 mentees, that is Anne Maria CB and Anna Benny. Okay, these 2 are my mentees. After this section, you can contact me personally. That's all about me. And I wish you a very successful life at Nirmala College of Pharmacy to everyone. Then I welcome Alicia Madam, one more faculty is there. Alicia is there. Alicia ma'am. Nancy ma'am, she there? I think Alicia Madam is not there.
I think Alicia Madam is not there.
Okay, ma'am. Then
Okay. I think Alicia Madam, she is unable to join. I think so. No issue. Okay. So, dear students, if you have any queries, please just give some message or something. If you have any queries or you want to know more about any other thing regarding our subject or anything about any departmental activities, if you want to know more, then you can ask us. Elsina madam, any messages are from the students?
No, ma'am.
No, I think, madam, they could hear my voice or not, because I just now I saw some messages that was not audible in Zoom or something.
Yes, ma'am, it's audible, but the thing is, some students are not aware how to enter into Zoom platform. That's why some issues came. So
Okay,
now
okay,
I think it is sorted out.
Okay, no issue. Dear students, don't worry about our subject. Okay, so we are here, myself and Nancy madam, both of us will take the going to take the human anatomy and physiology. I am sharing 1 hour with Nancy madam. So I think practical is also shared by both of us. So if you need any help in studying HAP, human anatomy and physiology, you can contact Nancy madam or me. Okay, if you have any issues. So already Nancy madam said the same thing. You have to love the subject, because here the HAP, it is the basic for few subjects in your following year. So you have to first you have to learn what is the basic of human anatomy and what is the basic of physiology and how the body systems are working. So you should understand the basic, then only you can able to study the other you can able to study about any drug, or you can able to study the mechanism of action of any drug, or you can study about the disease condition, etc., etc. So for studying all the basic things, all the diseases, and for covering the pharmacology subjects, you need the basic of human anatomy. Okay, so that's why so please all of you study properly. So we will give you all the reference materials, as well as we will guide you how to learn and how to complete the topic. Only the thing is, you have to cooperate with us and you have to walk with us, because we are going to show a path to build your career. Okay, your career is in B pharmacy or in pharmacy. You ultimately at the end of 4 years you have to build a career. So we will show how to build a career. Okay, so building is your responsibility. We can show the method, or we can show the ways, okay, how to build a career. Ultimately you are going to build a career. So you have to, if you are working with us or if you are walking with us, then only both of us, myself, ourselves, as well as you, can achieve something at the end of 4th year. Okay, നമുക്ക് 4 വർഷത്തിന് ശേഷം എന്തെങ്കിലും ഒരു കാര്യം അച്ചീവ് ചെയ്യണമെന്നുണ്ടെങ്കിൽ യു ഹാവ് ടു ബി വിത്ത് അസ്. നമ്മളുടെ കൂടെ തന്നെ നിങ്ങളും വരണം. ഓക്കെ, അല്ലാതെ ഞങ്ങൾ മുമ്പേ നടന്നു പോകുന്നു, ഞങ്ങൾ പോകുന്ന സൈഡിലല്ലാതെ ഞങ്ങൾ ചിന്തിക്കുന്നത് ഒരു വഴിയിലൂടെ, നിങ്ങൾ വേറൊരു വഴിയിലൂടെ ചിന്തിച്ചു പോയി കഴിഞ്ഞു കഴിഞ്ഞാൽ നമ്മൾ രണ്ടുപേരും ഒരു സ്ഥലത്ത് എത്തില്ല. ബിക്കോസ് അൾട്ടിമേറ്റ് എയിം എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ അറ്റ് ദ എൻഡ് ഓഫ് 4th year you have to build your career and you have to earn something. Earn it not in terms of money. അത് ഏൺ ചെയ്യാൻ ഉദ്ദേശിച്ചത് മണിയുടെ ടേംസിലല്ല പറയുന്നത്. യു ഹാവ് ടു ഗെയിൻ സം നോളജ് ആൻഡ് യു ഹാവ് ടു ഗെയിൻ ദ കോൺഫിഡൻസ് ടു വർക്ക് ആസ് എ researcher, or you have to gain the confidence to work as a pharmacist, or you have to gain the confidence to work as a industrialist, etc., etc. Okay, what all are the positions are open for you. In those areas you have to work. Okay, so at the end of the 4th year you have to gain those skills. So for gaining those skills, we will show you how to gain those skills, and if you are cooperating with us, then only you can come up with us. Okay, നമ്മളുടെ കൂടെ വന്നെങ്കിൽ മാത്രമേ ഇതെല്ലാം തന്നെ സാധിക്കുകയുള്ളൂ. സോ കോൺഫിഡൻ്റ്ലി എന്ത് കാര്യങ്ങളും എന്ത് ഡിഫിക്കൽട്ടീസ് ഉണ്ടായാലും ഒന്നുകിൽ ക്ലാസ് കോർഡിനേറ്ററിനോട് പറയുക, മാഡത്തിനോട് പറഞ്ഞു കഴിഞ്ഞതിന് ശേഷം തീർച്ചയായിട്ടും മാഡം വിൽ കമ്മ്യൂണിക്കേറ്റ് വിത്ത് അസ്. ഇഫ് ഇറ്റ് ഈസ് എനി സബ്ജക്ട് റിലേറ്റഡ് മാറ്റർ, ദെൻ ഡെഫിനറ്റ്ലി മാഡം വിൽ ഡിസ്കസ് വിത്ത് അസ്. വി ബോത്ത് ഓഫ് us വിൽ ഫൈൻഡ് എ ബെസ്റ്റ് സൊല്യൂഷൻ ഫോർ ദ പ്രോബ്ലം. ഓക്കെ, അപ്പം എന്ത് പ്രോബ്ലം ഉണ്ടായാലും നിങ്ങൾ നമ്മളോട് കമ്മ്യൂണിക്കേറ്റ് ചെയ്യണം. അത് എന്ത് ഇഷ്യൂ ആയാലും, ഇപ്പം നമ്മൾക്കിപ്പോൾ ഓൺലൈൻ ക്ലാസ്സസ് ആണെങ്കിൽ അതിലുള്ള ടെക്നിക്കൽ ഇഷ്യൂസ് ആണെങ്കിൽ പോലും യു ക്യാൻ കമ്മ്യൂണിക്കേറ്റ് വിത്ത് അസ്. ഇപ്പം നമ്മളൊരു അസൈൻമെന്റ് സബ്മിറ്റ് ചെയ്യാൻ പറഞ്ഞു, ടൈമിൽ നിങ്ങൾക്ക് സബ്മിറ്റ് ചെയ്യാൻ പറ്റിയില്ല ബിക്കോസ് ഓഫ് എനി ടെക്നിക്കൽ ഇഷ്യൂസ്, only the thing you have to communicate with us. Madam, these are the problems, that's why we couldn't submit on time. ഞങ്ങൾക്ക് സബ്മിറ്റ് ചെയ്യാൻ പറ്റിയില്ല, അതിൻ്റെ കാരണം ഇതൊക്കെയാണ്. അവിടെ പ്രോബ്ലം അവിടെ, അല്ലെങ്കിൽ ആ ഒരു നിങ്ങളും ട്രാൻസ്പെറൻ്റ് ആയിട്ട് നിങ്ങൾ ഞങ്ങളോട് കമ്മ്യൂണിക്കേറ്റ് ചെയ്തു, ഞങ്ങളും ക്ലിയർ ആയി ഈ ഒരു കാരണം കൊണ്ടാണ് ആ കുട്ടി സബ്മിറ്റ് ചെയ്യാത്തത്. സോ അവിടുത്തെ ആ ഒരു കമ്മ്യൂണിക്കേഷൻ ഗ്യാപ്പ് ഒഴിവായി, നമ്മളും ക്ലിയർ ആയി, നിങ്ങൾക്കും അത് കംഫർട്ടബിൾ ആയി. ഓക്കെ, സോ ഫോർ കംഫർട്ടബിൾ സോണിന് വേണ്ടിയിട്ട് നമ്മൾ ഓപ്പൺ ആയിട്ട് ട്രാൻസ്പെറൻ്റ് ആയിട്ട് കാര്യങ്ങൾ ചെയ്യുക, ട്രാൻസ്പെറൻ്റ് ആയിട്ട് പരസ്പരം സംസാരിക്കുക. സോ ഞാൻ ഓൾറെഡി പറഞ്ഞു, കണ്ടിന്യൂസ് മോഡിൽ സ്റ്റുഡൻറ് ടീച്ചർ ഇൻട്രാക്ഷൻ ഉണ്ട്. ഓക്കെ, സോ സ്റ്റുഡൻറ് ടീച്ചർ ഇൻട്രാക്ഷൻ എന്ന് പറയുന്നത് ഇറ്റ് ഈസ് ഫോർ 3 marks ആണ്. അപ്പം ഡോണ്ട് ഹെസിറ്റേറ്റ് ടു ഇന്ററാക്ട് വിത്ത് ദ ടീച്ചർ. യു ഓപ്പൺലി ഇന്ററാക്ട് വിത്ത് ദ ടീച്ചർ. ഓക്കെ, അതിനർത്ഥമില്ല എപ്പോഴും നിങ്ങൾ ചുമ്മാ ഹായ് ബൈ ഇന്ററാക്ഷൻ അല്ല ഞാൻ ഉദ്ദേശിക്കുന്നത്. യു ഇന്ററാക്ട് പ്രോപ്പർലി വിത്ത് ദ ടീച്ചർ. ഓക്കെ, സോ എനിക്ക് പറയാനുള്ളത് ഇത്രയേ ഉള്ളൂ. ഇനിയും എന്താണ് എൽസീന മാഡം, any messages or chats from, I think there are 7 chats. Let me check.
Nothing, ma'am. Nothing, ma'am.
No, ma'am, nothing.
Nothing. Okay, so what we have to do next, Elsina madam?
Ma'am, we can wind up this session. Morning session, we can wind up.
Okay, okay. Also, shall I?
Yes, ma'am. One thing I wanted to share,
Yes,
ma'am.
yes.
Thank you, Bharat sir, Preeti ma'am, and all other department members to give a very good introduction about the Department of Pharmacology and its subjects to our new students and motivating them. Thank you so much, dear teachers. And dear students, our next session will start at sharp 1:30 p.m. Okay, so please be online on time. And for that, I suggest you to log in at least 10 or 15 minutes prior to the start of the program, especially who are using this Zoom platform. Thank you, ma'am.
Thank you so much, ma'am. Thank you so much, Elsina madam and Principal sir, Bharat sir, and all supporting staffs of Nirmala College for supporting us. Thank you all my dear students for your patient listening. I hope I wish you all the best for your studies as well as for your future. Stay safe and stay healthy. Thank you so much.
Thank you,
With
ma'am.
this, we are winding up the session. Thank you.
Thank you. Thank you, ma'am.
Thank you, ma'am.